We have a quorum, so I will call this meeting to order. If you will, bow with me for a word of prayer. Our Heavenly Father, we're grateful to you for the opportunity that you give us each day to serve first and foremost you, and then our fellow man. We just ask that all we do and be in your name and in your favor. Any decision that we make here today, we ask that you would be with us and help us and guide us. And may they be in the best interest of each and every citizen of Scotland County. These things we ask in your name. Amen.
Amen.
All right, I need a motion to approve the agenda.
So moved.
Second.
Have a motion and a second. All in favor?
Aye.
Opposed, like sign. All right. Kevin, we'll turn it to you for the discussion on the COVID-19. Tim, how are you today?
I'm good.
Tim Ivy, are you there?
He answered. He says he's good.
So with this, in your packet is a copy of information that was sent out from DHHS this week. It's the color-coded copy of the state. It is the new system the state is issuing. It is a COVID-19 county alert system. Basically, they're color coordinating the state. They're make it a little bit easier to understand how the counties are prioritized from the state and even federal levels, looking at the metrics that really the White House is looking at. With that, of course, it goes yellow, which is the lowest, which is still significant. As this is a pandemic, as this is statewide, there are just no areas that don't have cases of this anymore. So it is all yellow. With that, we do have Scotland. Then the next level is orange, which is a substantial community spread. And then red is a critical community spread. At the end of last month, we were in the red. Now we have gone back down into the orange category. Our cases have not significantly decreased. I'll go over those here in a second. As far as new cases, the one advantage, and Greg Woods, CEO of the healthcare system, is on here also. He can talk about this. Is the hospital's in slightly better shape as far as the number of people in admission as it was months ago. The metrics that they use for this.
I don't have anything with the colors on
It's right there, baby.
it. Oh, it's under here.
Yeah, take your paper. clip
Oh, I'm sorry. Look right at it. Thank you. Wonder what Kel was talking about. Thank you. Okay,
There you go.
all right.
So with that, the three items that they look at, or at least for this, are the number of cases over a 2-week period per 100,000 people. In the last 2 weeks, we've had approximately 103 cases, new cases. Now, with a population of 35,000 approximately, you take that to you gross that up to that same rate per 100,000, and they're going to consider that to be 272 cases per 100,000. And the reason why that number is bigger, 50 cases in Scotland County means a whole lot more than 50 cases in Wake County. So they're just trying to find a way of comparing. After that, they look at the positive percent testing, and these are the nasal swab tests, like the ones that are done at the Doolin Center. They're more accurate,
Kevin,
and
this is Tim.
they
Can I
test
interrupt you
these
just a minute?
from all the labs across the state that report positives and negatives. And for Scotland County, our positive rate are 8.2% of all the tests taken are coming back positive.
As of today?
As of November 1st.
Okay. And how often will this be updated?
Can you hear
Monthly?
me?
Monthly. Tim has a question. He's real low.
No, I was just gonna say, if you can do it or whoever's controlling the mute, we're getting some background from the callers and other, if you could get that stuff muted to where we could, the online is a little jumbled with all that going on.
Okay. One second, I'll hit mute all. Okay. The third item is, that they use is hospital impact. And with that, that is exactly the stress level that you have on the local healthcare system. Before November 1st, I can effectively, for conversations we've had, I can effectively tell you that we would have been in the high category. Fortunately, the hospital has been able to, they have a few less patients in the hospital at this point in time than they did. So that's a positive strength. What they look at for the coloring is if you have more than 100 cases over a 2-week period per 100,000, and either a positive test rate of 10% or more, or a high impact into the hospital, you are a red county. Right now, we have the numbers, but our test rate is hovering around 9% instead of 10%, and our healthcare system is managing its condition. So that's why we're in orange. So again, the big change from 2 weeks ago to now is really our healthcare system is in a better state. With that, I'm gonna,
So does that mean that Scotland?
Yeah, let me know when it's my turn, because that was 2 weeks ago.
okay.
We are no longer in that state.
So that means that North Carolina, well, overall in North Carolina, are we still considered a hot state?
Yes, we are.
As I know my daughter's upset because she got quarantined for 2 weeks from going to the funeral yesterday.
Right.
You know, yeah, okay, so we're still a hot state, okay.
One last thing I just want to go over. You know me, I love numbers. So just going back over where we are. This is information I've gotten 2 hours ago. The daily cases, or the total cases that we have that are registered in Scotland County are 1,839. 1,702 have recovered. We had our most recent death, so we are at 37 deaths. So we are at 100 active cases. If you saw this number yesterday, we were at 71 active cases. So we had 30 cases develop since yesterday. And they are talking with Donna, trying to find out if there was there an outbreak? Did we have a nursing home, retirement home, an issue at the prison? They don't. These are all community spread cases. So we had a batch of positive tests that came back yesterday.
Have we ever had that many come back in a 24-hour period, Kevin?
That's a very large jump for community spread.
Yeah, it is. I mean, I look at the numbers every day, yeah.
Now, when the prison came in and did mass testing on inmates, absolutely. we had 100 in a day. But most of the time, any large spread like that is going to be tied back to a specific outbreak. This was not tied back to a specific outbreak.
And you said it's 31,
30.
30.
So somebody must be doing some partying.
The question was if it came back after Halloween, but you know, we're 2 weeks out, so that's late. But we did expect to see a bounce after Halloween. And of course, we expect to see,
The protests,
yeah.
but I don't know how many North Carolinians participated, you know.
So, and that's
Scotland
another,
County people, I mean.
yeah, and that's another reason with the holidays coming in, we expect to see some significant spikes coming in also. But if y'all don't mind, I'd ask Greg Wood to give us an update on, from the healthcare perspective.
My turn.
Yes, sir.
Good. Thank you, Kevin. Thank you all for calling this meeting. I think Kevin did a very good job presenting a lot of data out there. I think the challenge for all of us is you really got to look at this over the next 3 to 4 months, and a week or two at a time is going to cycle. So when this that new thing rolled out, 2 weeks ago we had a very good week. It tailed down. A week ago it started to climb up, and this week's been a bad week for us again. So it's really hard to pick a couple weeks at a time. I think as Kevin sort of alluded to at the end of his data comments, we were at 100, 105 over a 2 week period. But if you look at it for the last 7 days, it was 60. So if 2 weeks was 100, second week was 60. That means we've gone from 40 to 60 according to one measure. And again, there's a lot of different data components out there. But Saturday or Sunday, we had 10 COVID patients. A couple days ago, we had 15. Now we have 20. But the challenge is we're getting 3 in, 2 out, 3 in, 2 out. So you look at it and we see 15, 18, it's probably 3 or 4 different ones. So we continue to get a pretty decent increase. The other challenge from the hospital perspective is folks are delaying care. So this week, looking at my data, Monday, Tuesday, Wednesday, Thursday, we've had 93, 102, 94, 95 patients in-house. We can take care of 90 to 95 patients. So we've been at capacity every day this week. And that includes putting some adult patients on the women's side. So we are, again, ramping back up. And as most of y'all know, and I got a lot of support out there, this community campaign is really taking off. So, my challenge to everybody is we've got to do everything we can to stop the surge, or businesses will be forced to close. Schools will not be able to reopen. If the governor doesn't shut everything down, he may go county by county, which is what they have voted map. They may make choices by county. So we've got to do our part to slow this surge down. We have got some real staffing issues. We've got some real space issues. So there's positive rate 8%. We're shooting for 5%. We're up to 8 or 9%. Again, it's between 7 and 9 over the last couple of weeks. So we know we're going up. We know it may not be a straight line, but we know we're going back up. So anything the county can do to help stem that surge. There's programs out there related to curfews. There's programs out there related to ambassadors giving gold stars for those businesses that are doing a good job and frowny faces for those that are not doing a good job. I think those are some things we really need to consider. The biggest problem we have here, just like everywhere else, is churches. And I'm really encouraged by some of the campaign we lost. We've got some pastors out there, including B.J. Gibson, who said, I'm going to go to a bunch of the African-American churches, and I'm going to bring that material out there. I sent 150 letters yesterday to every particular church in the 3-county region that we serve to say, please, pastor, minister, plead with your folks to make those right behavior choices. And frankly, for those churches who continue to not mandate masking, I'm going to my employees here and say, if you go to that church, go challenge your minister to say, I get freedom. That's not freedom of choice these days. So anything we can do to help with the churches, the gyms, the restaurants to see how it's going, reward those who are doing the right channel and those who are not mandating the proper behavior is what I would really hope all of us, including you county leaders, do. So let me stop my proselytizing and be glad to answer any questions about where I think we need to go or what's going on at the healthcare system, because no doubt in my mind, the healthcare system is going to be trending up over the next 90 days.
You have 94 beds, is that right?
We are licensed for 104, Bob. 7 of those are inpatient rehab, which we've taken out of commission. About 14 of those are on a women's service unit. You can only put a few patients on a women's service unit. You can't put patients over there. You can't put infected patients over there. So essentially, we can operate about 90 to 95 patients. And over the last 3 to 4 weeks, we've averaged 90 to 95, which means plenty of days we've been at 100 to 105. The other challenge we certainly have is we have a 7-bed ICU, and we've been averaging anywhere from 6 to 14 ICU patients. So we've got too many total patients and too many critical care patients. Some are COVID, but some are just avoiding going to the doctor. And that's the other thing we're trying to get out there as a mission perspective, is don't delay that care. When you come here and you've delayed your cancer treatment, you've delayed your screenings, it's too late with your pneumonia, your heart condition, because you're afraid to come to the hospital, you're going to be really sick.
I've noticed in the reports that I look at that you've been pretty full for the last week or so with both in ICU and on the floor. Is that a?
Absolutely. Yeah, we've been taking care of ICU patients in the emergency room. We're getting ready to take care of ICU patients in the outpatient surgery holding area, and that's just not good care. So we need the community to help do its part with enforcing or mandating or strongly encouraging the right behaviors.
Greg, it's Carol. The last time I heard you speak about 3 weeks ago, along with the hospital capacity, you had a great deal of concern about staffing. What is your feeling? Where are you on the staffing of the hospital at this point?
Well, Carol, we are in the process of trying to, just like every other hospital almost in the country, we are trying to get 85 agency nurses to come. We have about 22 to 24 already here. Okay. We're supposed to get another 40 by December 1, but pretty routinely, they get a better offer and they leave. We actually had just had 2 days ago came in and said, a drug test. I'm not taking a drug test. We said, well, then you're not starting with us. So we believe we need 80 contract workers, and we have 20, 40 more have committed. They will come by December 1. We really are trying to gear up for the winter time. The other piece of that is they're going to be contract agency nurses who have never worked here before. So they don't have our same commitment to quality and service. And some of those patients will be in the wrong location. So again, back to taking a little bit of risk with the care we're providing. They'll be in different locations by contract nurses. So we are short, at least we're short 40 nurses right now, but what we think we need for the winter time.
Greg, I have a question. How easy or hard will it be to separate flu from the virus if someone comes to the hospital? To know what it really is. To know what it is, whether it's flu or the virus.
Yeah, they're very similar. So there are a couple things you can diagnose a little bit differently that we can do. The other thing we have is we've got a 4-plex, interesting, it's called a 4-plex lab test that you now can order either just for COVID or just for flu A or B or just for one other test. So when the doctor orders, he can order what he wants to check. He can check any of up to 4 tests. Part of the problem is we don't have that rapid test anymore. So until we get enough of this 4-plex test, we're having to send a lot of our lab tests out. But yeah, they can make some diagnosis. Sometimes it's pretty clear. Sometimes we've got to order this 4-plex lab test. Again, the jury's out. As most of you all know, the flu vaccine is anywhere from 40 to 70% effective. So which one did we all get? I hope y'all got yours. Which one did we all get? And how well will masking help? In a lot of places, Australian places, masking has really helped out the flu season. So many of us are hoping that the vaccine is very effective for the flu, the shot we got, and that masking over the last couple of months and for the next few months will minimize that flu. We don't know that we're going to be, clearly we're going to have some flu on top of COVID.
Thank you. Any more questions for Greg? Thank you, Greg, for what you're doing and what the hospital is doing, and just commend your staff for being there when they're needed, and thank you.
And let us know, I mean, I know you've tasked us with the authority of the board, but let us know of any way that we can do more than what we're doing.
Well, I think either at the board level, Carol, or as individual leaders in the community to again, we appreciate those who are getting it right.
Right.
And have the courage to challenge those who are not getting it right. Again, back to the churches, that's our biggest concern. It just amazes me that we have a lot of large churches here who are continuing to say, it's up to you whether you come to church en masse or not. That's just unacceptable.
All right. Kevin?
Now, with this, the state has sent out some information as well. You should also have, and it may be one page front and back for you, because the state has stated that basically counties can pass local ordinances that would layer on top of any state requirements. And of course, they're not looking at additional criminal penalties because that would be redundant. But they did suggest that local boards, county, municipalities look at actually passing ordinances that would make violation of this current executive orders have a civil penalty attached to it. Now, with that, of course, the counties can go beyond the governor's executive order. You just can't release the state's executive orders. And so with this, what they're coming in and they're suggesting, just because if it is just a criminal case, you're limited in the number of means and abilities to enforce anything. Also, the question comes back in, actually, would you actually want to criminally charge a business owner who's not providing PPE or something like that, or someone that's allowing gathering exceeding the number of people? However, it might be more tenable to go off and have a civil penalty. Okay, if you're having a business gathering of 100 people, of 200 people, versus having a criminal charge that goes into a court system, which is, so it's not going to be heard for 2 years, because right now everything is just backed up. Or, okay, we can do this and there's a civil penalty that can be addressed. That doesn't create significant more challenge, but hopefully would be something that would be manageable at a local level and increase participation.
How would you enforce it, Kevin?
Most of it, actually, we would use some of our other code enforcement abilities, are such like we do for solid waste, as well as in the health department. Those would be your primary areas. Now, it would still be significantly complaint driven, but just because we're not everywhere. But if there's a situation coming in and you go off and you're having a turkey shoot and you have 200 people there, well, we know who is organizing this, and if we had a civil fine, or civil penalty, that would be addressed to this, and it would be discouragement that's not criminal in nature.
So the people that attend a turkey shoot are they subject to being fined by being there?
It would be the business or organization.
Okay. I asked that because I thought that was the answer.
Yeah, so no, if you're having a party and you have 200 people there, that's not 200 tickets. That's one ticket for the person who's throwing the party.
But when I talked to you about this on the other day, I was thinking in terms of Dollar General in Waco. It's the worst I've ever seen.
Mm-hmm.
Every other person in there has no mask on. And so I am concerned about, basically stores that have a lot of traffic like Dollar General, Dollar Tree, those general stores, and even the grocery store. Now, to me, the grocery stores can afford to get some help there to monitor people coming in with masks, like Food Line. They can afford, to me, to hire somebody, to monitor that flow of people. But you got Dollar General, probably not, and Wago, whatever. So I think that we need to give a civil fine to the owner, to the manager, and then if they allow people to come in there individually, that's the part I don't know where we should begin to think in terms of finding the people that do not have a mask. Are we putting too much on the owner to say you cannot let people come in here without a mask and they have no backup? Like they told me when I asked the manager months ago, why did she not back up her statement on the wall, this door that said mask only, whatever? And she said she called our sheriff, and he said he won't back it up, nothing. But I take issue with that because he's paid by the Scotland County tax people. Why you can't take no issue with anything? But anyway, she said, and so that's why she did not try to enforce it, because the sheriff said he won't help her out. But she shouldn't have been calling the sheriff. She should have been calling the town of Wagram, because we do have a policeman that don't have work, but we have a policeman. So, these things, my interest when I talked to you about it was these situations like Dollar General, places that frequent a lot of people in our town.
Let me ask this question, maybe Ed can answer. Do we have any leverage with our sheriff in this issue? Because if we get into the red zone, then we're gonna have to do something. I can understand, maybe we wouldn't want to individualize at this point, single out an establishment or business. But if we get in the red zone, then
We were in it last week.
yeah, that's what I'm saying.
Yeah.
And so,
Maybe next week again.
so
Well, your sheriff is an elected official, just as this board is. And the main control you have over him is his budget,
his budget,
right?
including his
The
salary,
only thing,
Well,
we pay him.
You can't reduce his
We
salary.
can't.
No,
Okay.
but you do control the money that's
Well,
going to him. Now,
The sheriff,
Okay, so, well,
the sheriff said a couple weeks ago on that call that he was willing, he could enforce it. If the business called him and said somebody was coming in refusing to wear a mask and they wanted them to leave, that they would remove them. And if they needed to trespass them, they would do that. He made that pretty clear. As far as sending somebody out just monitoring it on his own, of course, he doesn't have a staff to do that.
well, you
But,
may be right. You may be right. The person that told me was that she said she heard a manager say that, and the manager had talked to the sheriff, but that may not be a correct statement. I back up there. I don't know.
Yeah.
May I speak?
Mr. Sheriff, are you on there?
Yes, sir, that's him.
Would you speak to that?
Yes. Listen, all the employees up here know, and we've had meetings about it. they got taken out of. If a store owner, whether it's Dollar General, Family Dollar, Walmart, it doesn't matter if it's in the city or the county. If this is Nick's pick, if they ask a person to leave and the person refuses to leave, then the officers have no problem escorting, arriving there, being dispatched there, and taking the necessary actions, whether it's to remove them from the store or to charge them. But they know if they put hands on somebody to physically move them, then they're going to have to charge them. I mean, that's just to cover yourself civilly. Now, we have a lot of store owners that will probably tell anybody anything. Well, the sheriff or the chief said that they wouldn't do this, they wouldn't do that, and that's not the case. I think I said this a week or two ago. The problem is that we are practicing it. I mean, we control it here at the sheriff's office, and we still have a few that test positive, just like our inmates. You know, we had that moment where we had 9 or 10, but I believe most of those, the way we got that was bringing them in from some of the prisons because, you know, the DA would rid them in. But we've been able to control it really well, and we're testing the guys. We tested them last, on Monday or Tuesday, we tested one shift, and the person that showed up yesterday for court that was positive, never told anybody in the courtroom. And so we had to have those officers tested again yesterday and today. So it's not about enforcing it. My problem is this right here, and maybe we can. I have no problem. Whatever ordinance that y'all want to put into place, I have no problem enforcing it. I just want to make sure that it's clear and it applies to every single person, because Tim will tell you, I've spoke to him about this, like Outback. They have 700 acres out there at Outback, and that they show up like if they were going to a rally or something. And if you put them across, they probably have an acre apiece of distance, but they don't do that. They may look that way when you pull in, but sometime during that you're getting calls that, oh, I got a group of people here. So the only thing I ask is if we do come up with some type of ordinance, and I agree with Mr. Woods, something's going to have to be done that we control those larger areas. And if it's 10 people in a crowd, then if I go out to Outback, I can move them. Or they're not going. And then the other problem is, and Mr. Patterson talked about criminally or civilly. He's correct. The civil is the best way to go, because criminally, if you bring them up there, they're going to let them go because of the COVID-19. And from my understanding, the district attorney's already said that she wasn't going to prosecute them criminally because these orders or ordinances and stuff have just kind of been far and wide because it's not clear. So I just ask, whatever you do, and I'll support it 110%, is that whatever plan we come up with, or ordinances we come up with, they apply to every single person, and they're actually there to help us control the crowd when we do respond. And so that's the only thing I ask. And the last thing about the civil, I guess my question would be is, we talked about a turkey shooting 200 people. If you show up and the organizer is charged civilly, once you charge them, and if it's $100 fine or $200 fine, you got 200 people there, and they all pitch in $1. How often? I mean, what's going to cause them to leave? Because they may say, $100 fine is what's $100? So I think whatever the civil fine is, it needs to be enough to where it'll make them understand that they do need to separate practice social distancing or do something,
So Sheriff, you're saying that
if that makes sense.
Sheriff, are you saying that if an ordinance is passed that doesn't have any criminal component to it, that you'll help enforce the ordinance if the punishment is a civil penalty, or if the consequence is a civil penalty? Is that correct?
I do. I think it needs to be to where it makes them understand that they need to, this doesn't need to happen again.
Right. I understand that.
You know,
My
it's almost like,
My question is, if the ordinance doesn't have
I'm
a
sorry?
criminal component to it, you're willing to enforce an ordinance in which the consequence is a civil penalty, not a criminal charge or something of a criminal nature. Is that?
yes, sir.
Okay.
Now, also.
Yes, sir. I agree with you. I think where people was getting me confused before, you know, like if you go to Lowe's and you walk into Lowe's and you've got maybe 80% of the people in Lowe's with their mask on, but you still have those that come into Lowe's without a mask. Sir, could say, you know, you really need to practice this COVID-19. And but if Lowe's is not going to put their foot down and say, listen, y'all need to come in when you need to come in with a mask or you need to leave, then I'm not going to stand there and charge a person when the business is not enforcing it.
Let me
If that makes sense.
Sheriff, thank you for your remarks, but I understand everything that's being said, right? I mean, I think we have to all share the responsibility. And this conversation is going in the direction where the businesses have to bear 99% of the responsibility. And yes, they need to do their part.
Exactly.
But we've got to have some way for individuals to also be responsible or burdened with doing their part. I mean, and Lowe's, because if you have somebody standing at Lowe's saying you can't come in because you don't have a mask, well, possibly in 15 minutes, you're going to be calling a deputy out to Lowe's because there's going to be a fight in the parking lot.
Yeah, that's true.
So I think we've got to somehow find a message, this is to all of us, that individually we have to bear some responsibility towards the wearing a mask, social distancing, standing back, and all that too. I want businesses to bear the responsibility, but I don't want it to be that our focus is just on businesses, whether it's Dollar General or Haney's or Lowe's.
Yeah.
I mean, we're all in this together. I don't know how to thread that needle to make that happen, but I think we need to be careful, because if we just focus on businesses, I'm afraid individuals are going to think they're off the hook.
Well, I really thought that we were going to do individuals also. I think, for instance, I think we could say, make a decision to give a civil penalty for businesses that allow people in general in there without masks. It's more or less a general statement making them see that they can't allow people to come in and without. You know, we kind of threaten them, but we're not really threatening, say it's a $400, $500 fine for letting people in here without a mask. But individually, we got to find a way to make these people pay out their pocket if they refuse to wear a mask. And that's the part that I'm confused about. I don't know how we can get to the individual. And I think Kara's right. They should have some of the responsibility. We can put up there on that glass door? It's $100 civil fine to come in this store with no mask on, okay? And then we put the overall amount on the owner. Now, and like Kevin said, could be complaint basis. You know, we'll know about it when somebody complains about it. And we can put a little teeth in the matter that way. But we also can have people in our county that could spot check these places every once in a while. We've had some type of monitoring system, maybe once a month. You can run by Dollar General, see how it's going, whatever. We don't have that many stores. So this is my vision of how we can change it. But whatever we decide, we're going to decide something now, because this thing is getting ridiculous. So I say, write a letter to the business, staff what we want them to know, make a paper for them to put out there on the door saying what the civil fine will be. That's my suggestion.
So I think what would help from our side is, whatever y'all, the commissioners, decide to do, is that it applies to every single person, not business. And what I'm talking about is if I go over to Dragon Park and they're out practicing football, and you've got about 20 kids out there, if the decision is no more than 5, like they've been asking to do it this Thanksgiving coming up, then that 5 needs to apply to every single group that decides to get together in Scotland County. Because if it doesn't, the first thing that I hear is what about Outback? They've got 20 out there.
Yeah.
And so that's what puts me in a situation. Now, if the ordinance, if it's clear, it's clear. And enforcing it is not a problem, but we just need to make sure that we don't say, well, if you're at Dragon Park, 20. But if you're at Legion Park, then or Outback, there's not a number because there's so many acres. And if we can just somehow y'all can come together and make it to where it applies to every single business, every single person, every single group, every single barbecue in the backyard. If it's all the same, it makes it a heck of a lot easier than me trying to figure out, well, I've got 10 at this house, but now I got 12 down here. So I just need a guideline that applies to every single person.
I understand.
You know, just like if the speed limit's 55 and you're running 56, you're responsible.
Well, that was my question to
So-
begin with, is how do you enforce whatever ordinance you do? How enforceable is it? Because you're gonna have, at my house, I'm gonna have 6. At your house, you might have 7. At John's house, he's got 15. So that puts John over the limit. And then down the street from John, there's 20. So it just,
I thought we were gonna deal with more or less, not the sheriff has brought this up. I don't even know where the Outback is. Where is the Outback?
Before you get to the prison.
Motocross park out there close next.
Used to be Skeeter Lake.
I don't know.
Is it
You
off
know
of
about Skeeter Lake?
1551?
Okay.
Okay, all right. Well, I thought we were gonna start out basically, but I understand what you're saying. You can't start out with a few. You gotta cover everything. But I thought we were gonna do the stores maybe first, but now we're thinking about the sport activity, Thanksgiving activity, this and that, so it gets bigger and bigger.
Would that not be easy enough? When we make the statement, we should do it, and we should do it now. You know, we should start the ball rolling now and get it ready for our next meeting. But since it's gonna include everybody, we just say any group greater than whatever.
Well, the state's just asking that you adopt civil penalties to enforce the statewide regulations, and then some specific, 3 specific things that in addition to that. So you don't necessarily have to recreate the restrictions. But they also suggest, and Kevin's got this too, that you consider adopting local ordinances in alcohol sales for on-site consumption at earlier times. Consider adopting ordinances with additional restrictions for public-facing businesses. I'm not sure what public-facing businesses are. I guess that means businesses where the public comes in.
That's what I was thinking, public places, not necessarily.
But there are a couple of things. Of course, if this is going to be an ordinance, you have to do the process to adopt an ordinance, which would require, in most circumstances, a public hearing with notice. So I don't know that you can have notice by the December meeting unless you have a special meeting. Although if it's on the 7th, I guess.
It's still looking 2 weeks
Might be
away.
able
And
to.
this is maybe our special meeting.
But it would include residences, churches. It would, I mean, doesn't that
Can
include-
it include churches?
No, I don't.
I think it can.
Are you talking about state regs?
Yeah,
Any
the
of-
sample ordinance here, the sample ordinance A, it's not talking about masking, it's talking about mass gathering. That's easier because is my mask on, is it off, is it showing, but this is mass gathering, you're there or you're not. But here it's talking about basically doing a penalty if you're having people, more than 10 people inside, and there are exceptions. Or you have more than 25 people outside.
What are the exceptions to the 10 people?
Governmental business, there are businesses, obviously there's more than 10 people in Lowe's at any point in time.
And where?
Lowe's.
Oh, yeah.
Any retail, they have,
Right, because of employee.
yeah, they have their own, they have a maximum occupancy based on square footage. So, this would be, something else, but basically this is looking at your mass gatherings. And it's very clear. So honestly, for this, it would be, 25 people outdoors. So whether that would mean that we're not going to have events at the Morgan Recreation Complex, but it also means that they're not going to have events out at Outback either. And I'm comfortable with both of those.
Yeah, and that you're not gonna have.
That's what we need, Kevin, what you just said. All I need is a specific number that we all, in case you get a phone call after we do our job, or that we're all on the same page. If I go to Outback and there's more than 25 people out there, I'm shutting them down.
Yeah.
And if I go to Dragon Park and there's 25 people out there in a group, I'm shutting them down. And most of them will leave, I think, without doing the civil. And all my officers carry extra masks in their vehicles. We try to give them out, but I just need specific numbers. And as far as with Miss Golston, I agree with her about the individuals too. If they're in Wagram or because my job is not as big as Chief, because unless I'm in these stores here, because Chief William, he manages all these stores and we're here to help him, but he surely has a larger than mine because he deals with them 24/7. And most of my stores like Family Dollar, Dollar General, but we all need that specific number where we have some authority. And then we can work on getting people to wear their mask. That educational level there continue. But it really helps to stand on an ordinance that says, hey, you got more than 25 people here and you're not social distancing and the ordinance says no more than 25, you're gonna have to disperse.
Yeah.
And
So
And
that hasn't been there.
does the limit?
That hasn't been there in the past. I mean, so, go ahead, I'm sorry.
No. Well, my question is, does the limit of no more than 10 inside, that doesn't apply to retail establishments? They've got their occupancy.
correct.
So, okay. Let me, this is just a general question.
I will.
Go ahead, Sheriff.
I will say this, the store owners, and we're not picking on the store owners or the businesses, but if we're only allowing 19 people to come into the big courtroom to sit down at social distancing, when that courtroom will hold 300 people, and we're trying to run court, if we can do it at this courthouse, and I only have 2 up there that works the door, then the store owners can do it in this county. It's not that hard to have an employee standing there at the door and saying, well, we got 15 here right now, we got 20, and we can't hold anymore, not to comply with it. I mean, they're going to have to do their part.
I agree with that. I had an experience just 2 weeks ago. I was in Fayetteville and I had to take care of some business at a big retail store. And I stood on the sidewalk for maybe 10 or 12 minutes until somebody came out and they let me go in. They were counting and communicating back and forth from the store how many people were in there. I agree with you.
Yeah.
It's not that hard.
Walmart used to do it, but they don't do it now. I see people come in, they don't say a word.
Also with that, your retail, most of the time you're dealing with part-time employees who are doing this, and the business owner may or may not care that much.
I agree.
So they're not really interested in trying to get the sheriff out to do a trespassing charge when, because there's no incentive. If you put a civil penalty in here on some aspect of this, hold on, if I don't do this, I'm gonna get dinged.
Mm-hmm.
Okay, now I need you to actually do something.
And
Don't just, at Walmart, don't just stand there and wave at people when they don't wear
That's
a
what they
mask.
do.
I don't want to pay that penalty.
And there's another element too that,
Yeah.
and the only way I know to describe it is called peer pressure. And I don't think these businesses want to earn a reputation of not cooperating with a community countywide effort to reduce COVID.
Yeah.
And I think that's the message that we need to try to send, that, I don't know what words to use. You don't want to embarrass anybody. You don't want to shame anybody, but you want us to come together so that a business doesn't get a bad reputation and another business gets a good reputation. And they are responsible for how they do that. So I think what we need to send an overall message that that's what we're looking for and what we're trying to achieve, along with civil penalties and ordinances and that sort of thing.
Well, we're gonna write hopefully a general letter, say to all the business owners, and give them what what we're trying to do here. And then we will put in that letter or whatever, the penalty that the business owner will have to pay if this doesn't happen.
Shouldn't they get the ordinance?
We went through the ordinance first,
Just
yeah.
give them I'm saying, just have a cover sheet and give these
I
folks
believe
the
Kevin
ordinance.
was leaning toward the A with the civil penalties it's laid out, and I think the sheriff said he would be able to enforce something like that. Am I right, Kevin?
Yes, sir. And again, this came from the state, this is their basis. But I think something like this is an excellent starting point.
But what they want us to do is impose civil penalties layered over what the state regs are.
Correct.
Not to create new regs.
Right.
Right.
So there's nothing necessarily, we're not pushing further, other than we're trying to add additional enforcement techniques to what's already there. I think simple ordinance B is primarily focused for sale of alcohol, and that's not our concern. We don't have Hillsborough Street here.
I was gonna say, I
We
don't,
don't.
In addition to this board's ability to address this, the Board of Health clearly has the ability to adopt rules that affect the protection and promotion of public health. So if it appears there's a shortfall somewhere, it may be that the board, if it chooses not to directly address it itself, the Board of Health is actually charged with some things of this nature.
That's what Jason told me when I asked him, just who you think would enforce this? And he said the Board of Health.
Well, they actually have the ability to adopt enforceable rules as well.
Mhm.
It'd be nice if we could do it together. I mean, if it could be a partnership between the Board of Health
Well,
and
we
the
don't
Board
have
of
that much
Commissioners.
time to get with the board and do all that, because we're gonna try to present this to this December meeting. We got to get busy. And we need to do it by December meeting, because this thing is getting out of hand. So we're gonna have to pin ourselves down and start where we're gonna start at and all this.
You've already got.
As I see this, as I see this,
Can I say one thing?
yeah, go ahead.
I think that where you're going with the occupancy levels is probably makes more sense instead of the mask enforcement. Not that they shouldn't do it, but I mean, I have this thing, and it's a lung thing that I can't wear them. I'm not supposed to wear a mask. I've been told that, and the pulmonologist enforces that, but I still do it if I go into a food line or somewhere, just because you know, if you see me out or whatever, well, he's not doing it. But I think if we make it individually on where you're not wearing a mask and here's a fine, there's going to be a lot of people that come up with this and just say, oh, well, I've got an exception or something to it. And, you know, then you get into where you can't really prove that because then you start breaking HIPAA violations and things like that. So I think the occupancy direction is the way we need to do it. So
That's gonna be probably your easier method.
Is there an appeals process in that draft ordinance that you have?
No.
Yeah, that's what I was gonna ask. How does the civil citation work?
There has to be some method to review it, because just like a situation like Tim's.
Well, no, use a business. If we went to a business who is not following the rules and we want to cite them, and the health officer cites them, what form does that take, and is there appeal from that?
That was my question too.
There's no specific appeal in the guidance, in the sample policy that they've given from the state. So I'm not sure what, the state administrative code, so I don't know if it would apply, and it wouldn't specifically apply.
Well, typically, if it's through the health department rules, it's typically appeal to the person who's
Right.
now the acting health director. But as the civil penalties generally, I mean, there would need to be an appeals process of some sort.
Theoretically, this ordinance will go away when and if the emergency response to the state does away with
Yes, sir.
emergency system, that thing would go away. then.
Yes, sir. When the governor's executive orders
Right.
on mandating occupancy, this would go away. It would still, we'd probably take specific board action at the end of it.
Yeah.
But you're looking at an ordinance that would be on the books for the next 5 to 6 months.
Yeah, if you're imposing civil penalties based on violations of the state regulations, whatever they are, and the state removes the regulation, you really don't have any basis for
Correct.
enforcing them.
It becomes unenforceable.
But you would want to clean it up and
Yes.
revoke it.
Yeah, I like what the sheriff has said, and I think rather than, as much as I would like to assign the individual responsibility to folks, I think and Greg mentioned something about encouraging the public. I think if this board, in cooperation with the hospital's effort to love the neighbor and wear masks and stand back, and with the cooperation of the sheriff's department, if we can communicate, we're trying to get greater control of what's going on. And I think we ought to have the ordinances in conjunction with the businesses to help them enforce the rules. I think one of the problems that's occurred is folks have not worn masks, have gone into businesses and have given staff of those businesses a lot of flack when they're asked to wear a mask. And if we have an ordinance that requires the business to do what they are supposed to do, we give them some backing as to enforcing the mask wearing.
Yes.
And I think that would be helpful if I were running a store and somebody came in and you told them, and you said, you've got to have a mask and I've got to require you to wear one or else I'm going to be fined.
Yes.
So I think we can try to encourage people to join the effort to get control of the virus while putting some other things in place that need to happen. And I think they need to happen. I think they need to happen sooner rather than later. And are you saying we can't pass an ordinance today? We have to have a public hearing for that?
I don't think you can pass an ordinance today, no.
Okay.
You can,
I don't think so.
no.
Well, what about a
Mr.
business-
Gibbs.
What about a business where the business owners are not wearing a mask? And there are businesses that fall into that category. I mean, granted, I can choose not to patronize that business and go in, but it may be a business that there's not really a good choice. And if a business has the plexiglass down, does that take the place of a mask?
I don't think.
Does anybody know?
They have it there.
No.
I don't.
I don't think it does either.
Yeah, I don't think it does either, but we have businesses where the employees are not wearing masks.
That's the truth. But we may not be able to cover every aspect, but at this point, Carol, I think you're right, and I agree with everything you say. But let's go on and do something. Let's get this ball rolling. I think Carol got a great point.
May I say,
Go
may I say
ahead.
this?
Go ahead, Sheriff.
If we can get an ordinance passed, what I can do is, I'll get it into the hands. Of course, I know that y'all will get it out there to everyone, but I'll get it into the deputies' hands, and I'll put it into their shift where we just start working on every business within the county, and they personally visiting those businesses during their shifts, and we do a little bit of educating on the ordinance and the importance of the mask and people coming in. And it shouldn't take a lot of time, maybe a week or two to cover all the stores, for I just think that one-on-one and explaining to them maybe the civil side of it, and an officer actually showing up and just talking with them briefly, because they need to visit the stores anyway. It may may make them
I agree with you, Sheriff.
I don't.
instead of just getting printing it off and being sent to them. I just think that one-on-one. And the thing about the civil part of it is, I believe most people would probably, if they have more than that certain number and you ask them to leave, they'll leave. If they continue to do, let's say the second time or the third time, they're not taking it seriously, then maybe go with the civil part of it as far as a fine. But I don't think we'll have that problem, that big problem out of the majority of the people. You're gonna have some that's just not gonna wear a mask because they don't take the virus seriously. And but I can say I think that the meeting is good, and I agree with Mr. Woods. If you don't do something, I don't know where he's gonna put the folks at. I mean, it's that obvious of how things are increasing. So, and I don't want to be one of them.
Yeah.
Sheriff,
Just like Tim Ivey with his help.
I think your deputies.
We don't want to be one of them.
I think your deputies helping communicate this, showing the cooperation of law enforcement would go a long way toward convincing people that this is the right road to take.
And
Yes, sir. And all I would ask is if any of you, like Miss Golston there at the store, if that happens again, please call me and let me know, and I'll send a deputy up there, because if she was just saying what her manager said, that's not if they were already in the store and they were asked to leave, but.
Well, that could be incorrect.
we'll
She
make it
said her
happen.
manager- I asked her why. That was when the governor first came out with the mask.
Yeah,
And I asked her why all these people in the store with no mask on. That's what she said. The manager said that she asked you, and you said you were not gonna find about it. But she could have been in error. The person could have given her just an excuse. But I appreciate all the help you can give, Sheriff, and I apologize for using that example when I didn't have proof. But thank you for your
no,
cooperation.
ma'am, that's okay. But that's fine.
I don't think we can approve this ordinance today.
No.
From what I'm hearing, we're gonna have to have a public hearing on it, I believe.
I've seen it anyway.
Is that right?
Anyway.
Do we
Yes.
have to wait 3 weeks, 2 weeks?
Well,
What is it?
no, you'd have to wait
Uh,
until,
10 days.
10 days or
From the publication, in the newspaper, which the soonest it
Do it
could be
at the
going would be
next
Saturday.
regular meeting,
Mm.
or December the 7th.
So we cannot
Well, you
approve
could
an
do-
ordinance before December 7th?
Yeah, you could do it the week of November 30th if you did it on the
Yeah.
Tuesday or Wednesday or Thursday.
It is 10 days from the publication in the newspaper, and the soonest it could get in there, if they have room for it, is Saturday.
Well, they can go in the paper Saturday.
Yes.
What date is Saturday?
The 20th.
27th?
The 21st.
21st.
21st. Okay, so we got time then.
So it could be on
If you have a special.
December.
But I think we've got to keep in mind here that we're going to have to cross that bridge on the public hearing about how do we have that as a public hearing? Because I think the School of Government's direction on that was when it comes to public hearings, that they need to be traditional public hearings. And Ed may could expand on that, but I don't think it can be done as a virtual public hearing.
I think that's right, Tim, because I think city council had to delay an ordinance or something that they were trying to do because it had to be done in person, not virtually.
So we have to do it by our next meeting then,
I
right?
can research if there's an exception to that or not.
Well, now, we have had public.
Well, the plan could be that you only allow one person in at a time, kind of like what we did with that
with the
zoning ordinance.
Yeah.
And do it that way. But I mean, I just don't want to, got to keep that in mind as part of this.
I think procedurally, you're probably better off doing it in a regular meeting anyway. Because unless you have a
Well,
unanimous
you're
vote.
talking the 30th, so you're talking a week longer, and I know a week is important, I know that.
Probably couldn't have it to Tuesday or Wednesday anyway, so it'd be less than a week.
You're right. I think that for the complete transparency and effort to communicate with our citizens, we probably should go to a regular
My
schedule.
suggestion would be to do like we did the other thing and have the public hearing and have one at a time come in, if whatever, to do it that way and do it at the next board meeting.
Yeah.
So if the interest of the board is to have an ordinance based off of sample ordinance like A, one recommendation would be also that instead of having it at the meeting at the EOC, that we actually have the meeting at Scotland Place again.
Right.
So we'd ask the board change the meeting location.
Mhm.
I'm curious, why do you think Scotland Place is better?
Easier to get people in and out,
Okay, that's all I need to know.
and plus, I don't want to crowd my EOC.
Right.
Okay, that's fine.
Yeah, the doors at the EOC are locked and they're locked. You have,
Yeah.
Okay, that's fine.
So the ordinance, how are we gonna write it? We're not gonna have a 2-page ordinance. We're gonna,
No, there's two different things.
yeah, we're gonna summarize this in one page anyway, right?
Do with number A.
Yes, we do A, which is.
We do A, okay.
Well, I think that the other thing in the ordinance, there needs to be some explanation as to what the citation means and what the process of that would entail.
Yes.
This one says alcoholic beverage. We're not
No,
talking
no,
about.
that's B. There's A right there.
Oh, I'm sorry, I'm on the wrong page.
if y'all are interested, December the 1st would be the soonest that you could have a public hearing with 10 days in.
I opt to do it, it's a regular meeting, I think it would be better. That'd be just my suggestion.
After thinking about it, I agree with you.
Now, also with that, the fact that the board is considering this, we would go ahead and try to get the publishing out this weekend, Saturday anyway. And then,
Although we already have that one public hearing
right,
for the CDBG stuff.
and then hopefully also have some follow-up coverage in Wednesday's paper. Just because get this conversation out there for Thanksgiving, to kind of get people to realize, hopefully this is a very serious conversation that we're having, and maybe I don't need to go with my 30 cousins and eat off the same turkey carcass.
Yeah.
I mean, I know that the paper is with us today for this meeting. I don't know if is JJ, are you with us?
JJ is here.
She was
Good, okay. Is there anybody here from the radio station?
Don't see it.
I don't see anybody.
Are we gonna say anything about mask wearing?
And that's something that we can continue to work on, and figure out exactly what that would do. But again, I think what the state sent out was just the simplest. Mass gathering aspect is
Yeah,
Is
I
very
understand important, right, but I sure would like to have a subheading, about mask wearing, but if we can't, we can't.
My understanding from what I'm reading and from what I've heard Greg say and you, is that the mass gathering is more of the contributory fact in the COVID spread and community spread. Everything that I've been able to ascertain in the last month, that it's people getting together in small groups without a mask. So, I mean,
I believe that.
yeah.
yes.
I hate to go to Dollar General and wait them, and out of the 10 people in there, 5 don't have no mask on.
I wouldn't go.
But see, I have a one store in Wakem, see what I'm saying?
I know.
I just cursory reading of this, does this exclude church or include church? It appears the definition is,
Greg, are you under the impression that churches are excluded from most of the governor's orders?
Yes, that's my understanding, and I don't know at the local level if you can do anything about that or not, but I think that is true. So that's why I think it's more about encouraging those churches, which is why I've encouraged my peers. But I'm excited. I think you guys are right on point. Really, it's about the gatherings. It's really about getting the word out now. If you can't do it for a couple of weeks, then you get ready to do that. So maybe you can start to identify where the areas that once it's passed, you want the sheriff to go talk to right away. But ideally, I think that ideally it's the person not masking, which is where, again, we just need to encourage and challenge. But where the problems are coming, it's mass gathering. It's the churches, it's the funeral homes, and it's those other social gatherings. And it's the personal ones we all worry about through the holidays that Kevin's addressed well.
The reason I ask that, and the reason I ask it specifically of you, because I think in conversations that we have when we talk about the civil penalties, it's probably going to have to exclude the churches. But I think we need to say that these efforts may not be touching the areas that are most troublesome. And that we encourage churches to take special care to protect their members, because I know that our church has a lot of older members in it, and we have taken, I think, good actions in order to protect our members, but we may not be doing enough either. So I think we need to ask all churches to take special. I mean, we've got folks dying at a pretty high rate right now. We had 10 in October, and we're going to have more than that in November. And I think and we've got, as everybody said, we've just got to get control of that. And I think the churches are a big issue.
And that's where you go after the influencers, and BJ Gibson's on the line, and he's done some fantastic things. So who are the influencers out there in ministerial and ministers associations that can leverage their influence to make change happen if you can't legislate it?
My church shut down instantly when the government changed over there.
Well, a lot of, and I know that the churches have had pressure from their own memberships to bring people back together. Because of the reason that people go to churches. They need the fellowship, they need the social contact, and that's the focal point of a lot of our families. But right now, it's just probably not the right decision to make.
Now, also, I will, exempting churches from this ordinance, just from watching the state struggle on this, you do obviously hit constitutional issues. So it would be significantly cleaner legislative if we just exempt
absolutely.
religious organizations.
If you exempt religious organizations, if that applies to Sunday morning and youth group on Sunday night and Wednesday night and choir practice and Boy Scouts at the church, is everything exempt that takes place at a church?
I think Kevin's point is that once you start infringing on anything related to freedom of religion, Somebody
So
mentioned.
all of that's exempt. And if it takes place at a church, it's exempt.
It
Okay,
it was on their campus.
on that campus, fire practice, session meeting,
Yes.
okay.
Well, along those same lines.
Well, I mean, do we need to even get down to defining individual places here? Or do we just let it read that it's gonna be following the governor's guidance or order on it and let it be that instead of saying, well, the church is exempt, but Joe's isn't, or et cetera, and just leave it. Hey, if you're exceeding what the governor's order is, period.
I don't know if you have a copy of this proposed ordinance in front of you, Commissioner Ivy, but its definition is.
I don't.
It's broad enough to include a church.
Yeah.
So we need, if we're not intending to include churches, we either need to do what you say if they're excluded under the orders, or we need to put some language in there to exempt churches from this definition of mass gathering.
And if you don't.
Yeah, well, he even said on his comment the other day that the churches were excluded.
Yes.
And that comes back from that earlier Supreme Court ruling on it, that the churches and church organizations were exempt from that. I just don't want to, I mean, if there's no need to mention it, why mention it? Because
the
we got to walk a fine line here with everybody, because in no matter what you do here, because we could do something here and people are going to start taking this as being Orwellian,
Right.
for the lack of a better word to use. And I just don't want to overdo it on it.
Well, whoever
I would
drafted this sample ordinance did not include language that would exclude churches. So you either tie this back specifically to the governor's order excluding them, or you just put it in here that mass gatherings are not to include churches. You have to do it one way or the other, or they're going to be included the way this ordinance is written.
And that may also be going into the definition of mass gathering.
Yeah, fine. That's where you do it.
If you, Tim, my thought is if you don't specifically say it, you're gonna have a gathering at a Rotary Club with 20 people and they're gonna say, well, why can't we do it if the churches can do it? And if you specifically excluded the churches, they can still say that, but at least you've got your ordinance enforces it against the Rotary Club, but not against the
Correct.
Methodist Church.
Well, I mean, I think
Right. Yeah, I understand. I just, since it's excluded in the governor's order, I didn't know if it was necessary to put it in there, but I mean, but then we open that can of worms is what if somebody rents the church and, that kind of thing. I mean, I know I'm opening up what ifs, but what if I rent the fellowship hall for the night or whatever? So I don't know. I don't know how we do
I
that.
think since this came from the governor's office, we use it as is. And if the churches think this apply to them, let them think that's to our advantage. Don't you think so, Mr. Johnson?
I would not leave it as it is, because it will include churches. And unless the board wants to include churches, then that's your
but that
choice.
overrides the governor's, well, we can do that. We do.
You mean?
Well, no, not according to the Supreme Court.
According to the
Again,
Supreme Court.
they already had.
Right, and the AG did not, the state was sued, the governor was sued about the church issue,
And he lost,
And he
and he
lost.
did not appeal it.
yeah, and he did not appeal it, so, I mean, as far as I'm concerned, churches are off the table.
But I just think the ordinance itself needs to be clear
It needs to be clear on, I
that
agree
they
with
are
that.
excluded,
Yeah.
because as it's written, it doesn't say.
It doesn't say that.
And once we say the churches are excluded, then they're gonna go wild and start church
Well,
back.
there's that risk.
They already know they're
Well,
excluded.
my pastor my church shut down instant when the governor said it.
I
So-
think 99% of the churches know they're excluded and they're making their own choice.
And they're choosing to look after their congregation.
Right.
For the most part.
For the most part.
Yeah.
If you put it in there, like Mr. Johnson, and I know Tim brought up about, or someone did, about what if they're renting the church. I think we can handle that part of it between our interview, whether or not it's a church function or they rented it to have a turkey shoot.
Yeah.
we can handle that part of it when it comes to what's happening at the church.
I mean, there's no.
That helps.
We're limited. I mean, you could have a person of a church want to have a family reunion and use the fellowship hall. We can't split all those hairs. I mean,
Isn't there something in one of the executive orders that limits weddings and funerals? Does that include weddings and funerals at churches?
I know.
That's correct.
I see an obituary it says that it's limited to.
I think there's still, the churches are limited to, for those
Yes.
they're
functions.
limited to capacity and mask wearing and
Mask
standing back. You're right, they are.
Right.
Mhm. Yeah, they should follow COVID guidelines. They're allowed to proceed as long as they follow the.
Yeah.
And part of that is because a funeral is a business there's a religious aspect, but ultimately it is a business.
Business, yeah.
The funeral home.
Yeah.
Is a business. The funeral home is not a religious
Right.
organization.
If we have a public hearing, do we have to have a proposed ordinance published before the public hearing for the public to see?
I don't think you have to publish it in the newspaper, but I think it needs to be available, for
For
review.
inspection.
I think,
Yeah, at the clerk's office,
Okay.
or, I mean, the manager's office.
I know that when we had the public hearing for the zoning, I had the zoning ordinance beforehand, and anybody who wanted a copy of that,
Mhm.
send it to them, and then we had copies available that night at the public hearing.
I'd have copies available lots of places.
But you just don't have to run it in the newspaper,
Now,
Okay.
and
the
also,
whole thing.
the ordinance can be modified after the public hearing, after the public hearing is advertised. So the final ordinance does not have to be advertised.
Can we modify the ordinance at the hearing and vote on it at the same time,
After the public hearing.
after the public hearing? Okay.
And it can be modified because of the public hearing.
Right, that's what I'm
Yes.
saying. We have a public hearing, we talk about it, oh, let's do this, this, and this. We don't have to publicize it and have another hearing, we can go ahead and vote on it.
Okay.
Kind of like the budget.
Anything else about this ordinance? Sheriff, thank you for your input. Greg, thank you for your input. All right, next item up is the Laurel Hill
One
Community Center.
question. So what we will do is we will advertise,
Saturday.
a public hearing on sample ordinance A, for the regular board meeting.
With the modification of it,
Yes. And that meeting, the regular board meeting will be held at Scotland Place, at the regular time. And we will use the same restrictions that we did with the zoning hearing, allowing one person to speak in at a time.
Okay.
Okay. Are we gonna modify that ordinance in any other way? I mean,
I would like to at least.
because I think most of us just got a chance to see it today.
I'd like to be able to suggest to the board that there be an appeal process of some sort, that maybe Kevin and I can get together on.
Okay.
But I just think
You
it's,
know, let Ed and Kevin, Jason, or whoever,
I
Okay.
think if
look
you're
at it.
penalizing somebody, they should have a right
They
at
should
least
have
to be
scrutinize
heard
the language in
by
it.
someone.
Anything else?
Do we need to take action on
I think you need to,
Modify the location.
yeah, I think you need to make a motion to modify, to move the
Move.
regular meeting.
that? Okay,
I
I'll
think
make a
that's
motion that we modify the sample ordinance that was given to us and schedule a public hearing at our regular December board meeting
At Scotland.
At
Park.
Scotland.
at Scotland Place.
Second.
Have a motion and a second. Any discussion? All in favor, let it know by saying aye.
Aye.
Opposed, like sign.
All right.
Was that you, Tim?
He said, aye.
Yeah, that was me.
Okay.
All right.
That was an aye in favor of it.
Next item is the Laurel Hill Community Center. I think we all got a update on the amount that it was gonna cost from Kevin and the architects. And it got it down within our original thinking it would be some $2,363,000 and some change, after making the changes in it. And, any discussion?
What was presented to, I can look it up.
The, what now?
2.8, 3.8.
3.8.
The
3.8 is what we got at the
3.8.
meeting.
Almost, the original
Yeah.
was almost $4 million.
Close to 4 million, okay.
It was 3.8, well, 3.9. And then the capital committee we met twice
Did you? Okay.
and, got it from that number down to the number that you see in front of you, 2,363,054.
Y'all did good, then.
We worked
Y'all
hard. man.
really did good.
And,
Goodness.
we didn't compromise.
We were down to inches on.
Pardon?
We did have a couple of questions at that meeting. They allowed me to sit in the capital meeting. Kevin, did we get an answer what they had allowed for the climbing wall?
The climbing wall was $63,000. So with that, Brian Graham has pushed the question back out to the Parks and Recreation Advisory Board, questioning whether or not one of the features in the building looking at the image, the top left-hand corner of the gymnasium, there is a artificial climbing wall. The cost of that feature is $63,000. So the question that Brian put out to the advisory board was whether or not they want, for that amount of money, have that climbing feature, or put in either a pickleball court, a basketball court outside, or actually go in and upgrade the walking track around the outside of the community center.
Brian had a suggestion that 61 or 63, we weren't sure at that time how much money was allocated for that it might be better utilized. And I think it's
everybody will be climbing the wall.
Right.
Everybody can walk.
And I think Brian was leaning toward the pickleball courts. I think did you get that impression?
I did, but I think it's good that he's taking it back to the advisory board. I think that.
Brian, are you still here?
Yes, sir.
Am I putting words in your mouth? Did you not?
No, I mean, we just sent an email out today just to get feedback from the advisory board, and we've had one response so far. I think the project can still go forward with approval. Something this small for $63,000, I think that's something that we can kind of work on, throughout the planning process.
Now, I wasn't suggesting that we delay anything, Brian.
No, we're not delaying nothing.
We want to make sure everybody understood.
We want to be playing pickleball out there this time next year.
How much does an outdoor basketball court cost, Brian? A good one?
I would say about $40,000, but I don't think, and I shared this with Mr. Patterson, I don't think that neighborhood is the best place to have an outdoor basketball court, because we got some complaints a couple weeks back from someone just flipping a tire, doing some exercising after dark. So
Okay.
I'm not sure how good that would go in that community.
We gotta have lighting, you're right, okay.
If I can speak to that, there was a basketball court up there. Neighbors complained about it because of the late hours, and it was taken up and done away with, so
Okay.
I would not even think about putting a basketball court outside.
Okay.
If you did, you wouldn't have put lights out.
That's right.
And that would
Yeah.
take care of the night situation.
Anyway, any more discussion?
I'd like to thank.
Well,
You're not
so we're
do that.
gonna,
I'm gonna make a motion.
so-
I'm gonna-
well, right now, I just want to make
I'm
sure
gonna reserve
we're gonna-
that right.
Go ahead,
we're
Dan.
not gonna have a climbing wall, but we're gonna reserve those funds for pickleball / walking track upgrades or whatever, right?
Right.
And when will we see the facade, the plan for that? What would that look like? We have the floor plan, but I don't.
If
It was sent to you.
Okay.
If you go back to the original drawing, it had
It's gonna be like the
pickleball
original.
courts and a little
Yeah.
expanded area in the gym for walking track.
Saw that last month.
Yeah.
So the outside won't change much from the original?
No.
Okay, just the floor. Okay.
We have not gotten a new front vision of the building since then.
Yeah, they wanted us to make a decision on the, on,
On cost here, get the
well,
cost right.
and on the square footage kind of stuff.
Okay.
And also with this, the board presented in the packet is a copy of a project ordinance that was done that would allocate the funds to prepare this. It would be a project ordinance because there's no way it's going to be finished before June 30th. So it would be up to the board to approve the project ordinance, which would allocate the $2.3 million necessary out of fund balance for this. It's all fund balance at this point in time. We will apply for a Parks and Recreation Trust Fund grant, but we can't budget that until we receive it. So that would be done later and hopefully be a modification to it, so.
And I'm told that would be about $500,000. Well, my motion would be.
But that grant could go ahead, the request could go ahead without the building having started, right?
Yeah, Brian can answer that question. I think it would have to be a little bit later in 2021 before he could apply for that. Is that not right, Brian?
Application is due in May of 2021, and the awards are in the fall of 2021. But I will say this, I spoke with someone from that organization this past week, and they highly recommended us not to apply for $500,000 because, it's rare that they award the full amount because of the competitive nature of the grant. So they recommended for us to apply for 300 to 400 at a maximum. So I would follow that advice and not shoot for the $500,000.
Yeah, but you could apply for it if we approve this as a project. You don't have to wait on the building to be completed, right?
That's a question that I have to take to them. I'm not sure about that.
Let's move on with the
Okay.
approval. I'll move that we.
No, you're not moving nothing. I'm
Oh,
moving.
I'm just making this motion,
I'm
y'all.
making this motion.
You sure are.
Offer, you are not
And you done said it 3 or 4 times, y'all.
John, I'm gonna remind you, you can't talk.
You tell the preacher you can't.
I'm gonna second the motion.
Okay.
All right.
My motion would be to follow this Laurel Hill Community Center project ordinance to build the Laurel Hill Community Center as outlined in the plans and with any modifications that might happen along the way, and get started just as soon as we can and be in it as soon as we can. That'd be my motion.
I'll second that motion.
Any discussion? All in favor, let it be known by saying aye.
Aye.
Opposed, like sign?
All right.
All right, so it's unanimous. Kevin, can you start breaking ground next week?
Got Tim.
Tim,
No, I said aye.
You said aye in favor of the project, right?
yeah, you did.
Yes, yes.
Okay,
It just takes him a second to unmute and everything else.
Mr.
Yeah, I'm
Johnston
playing
was
with-
afraid your aye came in during the negative vote.
I'm trying to figure out which one.
No, I'm still trying to get used to this new Apple iPad that Jason gave me.
I just want to make sure. Sir, thank you.
All right, is there anything else? If not, I'll entertain a motion to adjourn.
So move.
Have a motion and a second. All in favor?
Aye.
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 Thank y'all for being here.
This conference is no longer being recorded.
Bob,
Ma'am,
pleasure to see you again.
do what they-
I said, it's a pleasure to see you. I didn't come to the last meeting in person. And, it's a pleasure to see you again.
It's always good to see you, Mr. Eddie.
And I'm gonna miss
Kevin,
you
remind
so
me, I need
much.
to ask you something before I get away from you.
I've got 2 weeks of council government tonight.